Hello, welcome again to another edition of Matters of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Cardiology. I'm Seth Bilazarian, a clinical and interventional cardiologist with PMA, and I'm with my associate, Dr. Srivastava, a regular here on the show, to talk about a topic that actually was suggested by one of our viewers, asking us to do a presentation or a discussion about a topic that I hear a lot about in the office, and that's the matter of stress in the heart. We hear people say, whether you're a doctor or not, people say, I'm very stressed, I have a lot of stress in my life, personal life stress, professional life stress. How does this play into the role of our health in general, but particularly our heart health? What does it mean? How do we sort it out? Is there any reasonable science behind it? So I'm just going to turn it over because I'm very enthusiastic to hear what Dr. Srivastava has to say about it. Teach me.
I will try. Thank you. And so just as you alluded to, doctors, patients, the general public, scientists have long puzzled over the question of how people have heart attacks despite having normal blood pressure, normal cholesterol, not smoking, no diabetes, no real obvious risk factors. And there's a large group of people out there who feel that behavior plays a great role in this sort of thing, stress, what we're talking about. Obviously genetics is a very potent part of this as well, but that behavior and how one reacts to certain situations or how one copes with certain situations plays a major role. So the hypothesis is that the way people think, the way they feel, how they cope with the daily stresses of life, not only extreme stresses of life, but just daily stresses of life, how one copes with those things can really have a profound effect on the heart. And so we'll talk a lot more about that. There are a lot of common traits that scientists over the years have come to see, common behaviors, common reactions to things that are associated with increased heart disease.
So I guess what I'd like to know is there a good definition for a medical or for just a working definition for what is stress?
Yeah.
I mean, I think about, anybody in a circumstance who may not be stressed but is in a difficult marriage or difficult family life or loses their job or has the death of a family member. Those are all stressful things. Yeah. Does that mean that those people are stressed?
Sure. I mean, stress, I guess it's one of those things, you know it when you see it type of thing. It's tough to put exact words to it, but people over the years have developed evolving definitions of stress, and it's first really talked about in the medical literature anyhow in the 1920s, 1930s, first described as really the feeling of being stretched to your breaking point, sort of an easy way to like a rubber band being pulled and pulled and pulled. Others have described it as the things that lead you up to having facial tightness, clenched fists, jaw tight as well. Whatever leads you to that is stress, basically. Later researchers have come to the definition of calling it or stating that it is the state in which individuals are faced with the need to make difficult or undesirable change in order to adapt to the events or the situations in their lives. I'm not sure we need such a formal definition to really understand what stress is or what it's not. I think it is one of these things where you know it when you feel it, you know it when you see it, etc. Things are, I think as you alluded to, there are highly significant, big major stressors, loss of a job, loss of a loved one, getting ready to take part in armed combat, major things. But more often than not, it's our response to or how we cope with the daily things, traffic jams, argument with a coworker or a loved one, a deadline that you have to reach at work or at school or what have you. That stuff takes place every day. That's real life. And so I think what we're really talking about how we respond to those types of stressors, not the big major ones quite as much, because those are usually much less frequent. Okay.
But I guess I'm still a little bit confused, and I know this is a challenging area because you and I aren't formally trained in this area, although we're physicians. There's not a lot in medical school and other training that we've gone through about this topic, right. But it is one that's of interest to us because we want to do the best thing we can for our patients. But by what you just described, if someone is in a stressful circumstance, you described all those different circumstances where someone might feel stress. Mm-hmm. If they feel themselves getting red in the face or clenching their teeth or just really uptight, yep. If they can catch themselves and relax, are they no longer stressed?
Sure. Absolutely. That's actually a major, when you talk about therapy for this sort of thing, the recognition of cues leading up to stress. And we can talk about this later, but the recognition of that and the ability to subvert that or to get out of that if you have that skill, it's tremendous. Most people don't have that skill, I don't think, but absolutely. So what might be stressful for you may not be the least bit stressful for me. I can friends who, if they're in a traffic jam, they'll go crazy. Their blood pressure will go through the roof. They're angry. They're swearing. And whereas I couldn't care less. I don't sweat it. And so for me, that's not a stressful situation. Whereas for somebody else, it might be an incredibly stressful situation. So absolutely, it is very situational specific. And it's really more boils down to how the individual copes with an event in life. You recognize the event, you interpret it, and then how you cope with it or how you handle it or respond to it really defines whether it is stress for you or not. There are, of course, a couple things to mention. That there is such a thing as good stress. It can be what spurs people on towards certain accomplishments. There's the joy experience with successful accomplishments. Those types of stressors are good, generally speaking. But
I guess we might think of those people as thrill seekers, people who like to maybe climb dangerous mountains or sky jump would be examples of
there's that.
Like taking on the stress. I mean, extreme examples, I guess, but of taking on a stress and overcoming it. Is that what you mean by that?
There's that, or there's the stress of maybe having to get up and speak in public, but once you finish it and are accomplished with it, and you've given a great speech or delivered a great presentation, there's a feeling of accomplishment with that you had to get through a little stress to get there, but it was a good thing in the end.
Relief, I guess.
Yeah, that's right. It might be more relief. And so what I wanted to talk to you about quickly, before we talk about how stress works and the physiology behind it and everything like that, is really just sort of point out, actually I might even just read off a paper, I should have had a slide with this, but just the physical indicators of stress that you might see on somebody, emotional indicators when you watch, or behavioral indicators. And it's a long list of things that can be a sign of many things, but physical indicators when looking at somebody, so facial tautness, just having a real tight bearing down on your face, aches, stiffness, tension, headaches, sweating, facial flushing, cold, clammy, sweaty hands, or sweating in general, facial tics. People can't sit still, always tapping their feet, or playing with a pen or something. People have ringing in their ears when they lay down to sleep. It's often a sign of stress. I know of people who, during the week, every day, they go to bed ringing in their ears, drives them crazy. Saturday comes, no problem whatsoever. Monday comes around and it comes right back again. It's very much related to stress with their work and job. People break out in rashes or hives, or eczema can be flare up, or acne as well is often seen with stress. Other things, palpitations is another thing as well, the sense that the heart is racing. Those are some of the more common physical indicators of stress. Of course, you can see those things with a lot of other things too. Emotionally, people can be impulsive, angry, emotional. They can withdraw, and you can see a lack of emotions, and people just sit there quiet and don't say anything. Irritable, maybe excessive talking to oneself, or difficult to explain crying, or the whole gamut of things. Difficulty concentrating, forgetfulness, all these things can be emotional indicators. And then some behavioral indicators, rapid, pressured speech, interrupting others, finishing their sentence for them often is a sign of it, rapid walking, excessive drinking, smoking, drug use, multitasking, which we often think of as a good thing to do but can sometimes be a sign of stress, trying to do many things at once, restlessness, pacing, biting nails, inability to sit still. I think you get the picture. All these things are sort of the signs of, or some possible signs of stress.
Okay. As you were going through them, I was thinking of the television show that's popular now called Lie to Me, about the signs of stress that can indicate someone not telling the truth, and some of them, the facial tautness and others, are highlighted on that show. But
so, yes, I guess you're under stress when you're lying to a police officer, or you should be under stress if you do that, I guess. So I guess what I was gonna talk about next was a little bit more about how stress works and what makes something stressful for you versus me, and as we were talking about before, the example of the traffic jam, how someone might get very stressed with that where someone else couldn't care less. And I think we said this, but one is faced with a situation. So let's just use the traffic jam as an example. You're faced with a situation, you interpret the event, and then you react. Are you calm with the reaction to it? Are you irritated? Are you anxious? That's really the crux of how stress develops. And then there's a whole chain of physiological reactions that we'll talk about shortly about that. But there are other things that can affect this as well. The perceived lack of control, or control, I guess I should just say, plays a role and affects how one responds quite a bit. There's lots of studies looking at assembly line workers who, when they have control over the time and the pace and what have you, they score very low on stress level scores. Whereas when they don't have control over things and things are just being forced down the line, with stress levels very high. There's lots of different studies looking at that exact type of scenario where control plays a major role. Predictability or unpredictability plays a role. So I guess think of the loud sound that comes up, that if it's unpredictable and sudden and scares you, that's a stressful thing, whereas a loud sound's coming up, doesn't bother you in the least bit. So predictability plays a role in how one copes with stress. But another thing is what people in the business, so to speak, refer to as stress buffering resources, support network. Are you a loner? Do you have friends? Do you have relationships who you can lean on, et cetera? Do you have a good sense of self-worth? Those who don't have these things often handle stress very differently than those who do in a negative way. So what happens physiologically? What happens in the body when, let's see, you interpret an event and it's irritating you and you're getting anxious and it's stressing you out, so to speak? So what happens? Well, the body reacts by stimulating what's called the sympathetic nervous system. So in layman's terms, your body's getting revved up and you're starting to pump out adrenaline-like substances. The brain reacts to this as well, and your body's secreting certain types of hormones like adrenaline. We'll just call it adrenaline for lack of a better term, but adrenaline-like hormones, steroids, cortisol. Your body is also mobilizing fat from tissues, creating fatty acids, which is an energy for your cells and your muscles and body. And with all these hormones and mechanisms, heart rate goes up, blood pressure goes up, your platelets in the bloodstream become more activated and more active. And so that, over time, if this is a long, continuous state of arousal of this sympathetic nervous system, that might not be so good, to always have your blood pressure being driven up, your heart rate driven up, platelets being more active than usual, and the fatty acids being mobilized as such, and glucose is mobilized as well. So a lot of potentially negative things that if it's one spike here or there, not such a big deal. But and this is often referred to as the fight or flight response. And our bodies, I think, have this response. Think about thousands of years ago, you're met with an animal in the wilderness that you got to either fight or flight. This is a perfect response to have. You can often do superhuman things with this response in your body from a strength standpoint or endurance standpoint. But nowadays, a lot of our stresses are more mental in nature, and we're more sedentary, certainly. And the same mechanism exists, but we're now not, quote-unquote, burning it off, so to speak, or using up the resources we have. And so that's a problem in how our bodies in the year 2011 handle mental stress. And actually, the mental stress is usually more chronic, ongoing, long-lasting, and so our bodies are exposed to much longer periods of this bad hormonal atmosphere, meaning you're revved up, so to speak.
So I could certainly think about that as you were describing it, that the fight or flight mechanism you described. So someone gets ready to fight because they had some kind of stress, using your traffic example. But if you're in traffic several times a day and you're always fight, you can almost get to this concept that people talk about, combat fatigue. I mean, you just get sort of drained down because
Absolutely.
You're always ready to fight.
You're always amped up. You're always at the top. And but the same thing is going on in your body from a neurohormonal standpoint, with the stress of you got to pay the rent or the bills, or I'm going to lose my job and it's tough at work right now, or et cetera, et cetera. There's a zillion things I could list there that it elicits the same response in your body, and you're not burning it off, so to speak, by fighting the bear in the woods or running away from the dinosaur or something. It's a very different reaction we have now, and it's and so it's a negative thing. And so you can imagine that, let's say you're somebody who does have some plaque in the artery. So this is where stress can lead to. The phrase we use is ischemia, or decreased oxygen to the blood. Let's say you do have a blockage of 50, 60%. Now, when you're doing all these things, the heart rate's going up, blood pressure's going up, the arteries are constricting a little bit. That blockage can become much more significant, and the arteries can close up even more on that, and the heart is demanding more oxygen, and blood can't get there, and so you can often develop chest discomfort in the setting of stress. And that's where stress can be a provoker of what we refer to as myocardial ischemia, or diminished oxygen delivery to the heart as a result. And so it's a major issue. It can certainly bring on angina or chest pain, but can also, over the long haul, be, as we'll talk about, a independent risk factor for development of coronary disease.
Okay. So as you were talking a little bit about it, and I don't want to take things out of order for the way you've planned to talk about it, but I was thinking that some people in our audience might be saying, well, I have the stress, I have personal stress, I have professional stress. You know, I have issues with my family, I have issues with my job. So one thing he's telling me to do is just to not care, and then everything will be fine. I won't be stressed. So how do you conduct yourself responsibly? We still have to, you know, make a living, take care of our families, but also not get stressed. Is there some kind of the immediate solution? Of course, everyone always thinks that we hear this in the office. You know, well, if I can't do this, I have to do all the other thing. Well, that's not, of course, where we're going here. But what are your recommendations?
I mean, there are. Actually, I'm going to skip ahead in this paperwork. There's a lot of different coping mechanisms and behavior modification techniques, learning how to cope with the stress that's at hand. And so specifically, I guess there are, there's a long list of things, relaxation techniques. And what people, actually, I should back up even before that, just simple exercise. Exercise, if you want to think of it this way, burns up those hormones that have been revved up and got your adrenaline going and mobilize the fatty acids and have your blood sugar up high. Exercise is a very good way to burn that up. And so, and I think everyone recognizes they feel better mentally when they're exercising, and even just a brisk walk at the end of the day to quote-unquote burn that up is a very useful thing. There's lots of studies looking at counseling or looking at psychotherapy, which is thought of as to be the best thing to do, or group therapy. And group therapy works very well in certain scenarios. People who've been through a traumatic experience, for example, whatever it may be, bombing and there, or bereavement. So group therapy works very well for those types of people. Building and maintaining relationships, having that good social network we talked about earlier is a very important thing. Even people recommend even having a pet. The need to take care of something else or someone else is a good thing for your health, certainly. There's relaxation techniques that some of the stuff I've looked up, I'm not going to go through it here exactly. I'm not an expert on how to walk somebody through relaxation techniques, but there are psychologists who specialize in this sort of thing, so that's something that's very useful to do. Behavior modification techniques are very useful. So working with somebody to recognize their arousal cues. So the traffic jam example, you start to notice you're getting flushed, sweat, heart pounding, and then going through certain techniques to get yourself out of there, to get yourself out of that situation. So these go a long way to help you out, certainly. Biofeedback's a much more complicated way of doing that, but you can be, and it's interesting, you're hooked up to a monitor and presented with these stressful situations, and they start
a pulse monitor of your heart.
Yeah, there's different kinds where you can see a graph going up and up and up. When your blood pressure's starting to go up, you can have a cuff on the whole time, your heart rate's starting to pick up, and so you have to work inside of you to get it back down. And the more you do this, and the more in tune you come to your body, the better you do. And so there's places we can go to get biofeedback training. There's anger management, is a very popular phrase, stress management skills, imagery, increased awareness of your physical cue, all these different things. So there's a lot of things that people can do. By no means do I suggest, or I think as anybody suggests, that you just stop caring, drop all of your responsibilities and mail it in, and that's it. It's learning how to deal with those responsibilities or cope with those responsibilities. And I think that leads us a little bit to talking a bit more about the quote-unquote type A personality, because that's who we're talking about, who primarily is susceptible to the stress and to have stress affect them poorly. And so we can talk about that a little bit more. Everyone uses the phrase type A and maybe not know where it comes from or what it really means. Years ago in California, there were two cardiologists named Friedman and Rosenman who first set out to interview all their colleagues to try to figure out what types of behaviors were more likely to exist in people with heart disease than in others. And they came up with all these, and then they started to interview their patients, and they developed a database of over thousands of patients. And what they ultimately came up with was this type A behavior pattern that they felt is present in about 50% of society, which my anecdotal view, it seems a little high to say that, but nevertheless, that's what they felt. And they felt that what drives this, it's characterized by a continuous, deeply ingrained struggle to overcome some sort of obstacle, real or perceived. Obstacle of either other events, other people, or time is a big one. The need to overcome that obstacle all the time. And what often fuels that is the underlying sense of insecurity or self-doubt. It's a pretty potent motivator. I always say to myself, fear of failure is a very potent motivator, but that's a very common thing that drives type A personalities. So what do we see in type A people? So typically, they are impatient, they are competitive, easily irritated, quick to anger, they can be suspicious, they can become hostile. They're often actually, perhaps as a result of this, in what's perceived to be highly successful professions. They are often, though, not satisfied with themselves or what they've accomplished or what they've done. They try to do more than one thing at a time. For example, talking on the phone while working on the computer is a common thing. Eat while driving, preoccupied with deadlines, always thinking about what's next, speaking loudly or tersely, interrupting others, finishing their sentences. These are all characteristics that have been shown in the type A personality, men and women. It's same types of personality traits. In type B, just think the opposite of those things, very different. But the type A personality, what makes them more prone to heart disease is the greater sympathetic nervous system response to any of these stressful or demanding situations, and they perceive more situations to be stressful and demanding. A deadline at work for them might be much more stressful and demanding than to the type B carefree personality who, I don't care if I'm late, or I don't care, no big deal. And so that constant low-level state of arousal in the type A personality in the long run can be a very negative thing.
Are there extreme examples of these kinds of things causing immediate harm? You've been talking a lot about how someone who's in a constant state of being stressed, a type A personality or other, can sort of be at risk because their blood pressure is a little bit higher. They have these other examples you use physiologically that can be harmful in the long run for health. But are there things that can happen suddenly to someone that's a stressful circumstance? Are there examples of that?
Absolutely. I mean, one is an acute myocardial heart attack, certainly. Stress can bring that upon. But the thing I think you're alluding to is this big thing. It's referred to as a stress-induced cardiomyopathy. And there's a lot of other names for it. In the medical literature, it's referred to as Takotsubo cardiomyopathy. In the lay press, it's referred to sometimes as broken heart syndrome. And the classic example of it being actually a patient I can remember from the hospital a few years ago walked in a room to find their mother passed away on the floor and immediately developed chest pain and had all the classic signs of a heart attack themselves. Brought to the hospital, and their EKG even looked like a typical heart attack, suggesting a blockage of an artery. So we're brought immediately to the cardiac catheterization lab, and all the coronary arteries were wide open, looked beautiful, no problem whatsoever. But the heart itself was completely stunned, wasn't squeezing like it should. And this is...
was weakened.
Yes, weakened. Right. So ordinarily the heart should be squeezing down like this, and it just was motionless. And then part of it was moving, but it wasn't doing anything. And this is a textbook example of a stress-induced cardiomyopathy, this Takotsubo cardiomyopathy. And it's thought that those who are susceptible to it, the way their heart's nerves are, they react negatively to the surge of, I'll just call it adrenaline for the sake of conversation, but as other types of neurohormones, that you're more prone to reacting in this fashion than typically you should be. Obviously, there's a lot more to it than just that. It's, I think, becoming more and more recognized and more known about, certainly. I can remember when I was training in residency, we were just starting to talk about this, and not too many people knew. And I think now you talk to a medical resident, every single medical resident would know about this condition at this point.
So that's an extreme example of some kind of stress, and the patient's response to the stress causes an extreme heart-related issue.
Yeah, that's life-threatening, that condition, certainly.
But most of what we've been talking about earlier are really the sort of chronic stressors that are part of life. And I think you've given some really great examples about what that stress response is like. And you've talked about some initial strategies of at least recognizing yourself as somebody who may manifest this, and gave some general ideas about what to do to begin. But I think you highlighted exercise. Are there any other things you can have as a recommendation for our audience as we come near the end?
That's a good question. One thing is certainly self-assessment, or if you're really seeking formal therapy and treatment, then there's certainly all sorts of assessment modalities, whether it's interviews, questionnaires, etc. I have one here. I'm not going to read it right now. It's pretty straightforward, but very simple, 14-question thing about your personality type. Are you never late, or you're casual about appointments? Are you very competitive, not competitive? Are you always rushed, or you're never rushed? So all these different, and you can get a very quick scoring system just for even self-assessment to see what type of personality you are. I think it is useful there's a lot of data, I'm just going to get to the point here, a lot of data that if you score this way on this test, you are at higher risk for coronary disease, almost 2 times greater than the opposite at risk for a coronary event. If you've had a heart attack and you're this personality type, you are at risk for recurrent events. So it is important to get this in check, certainly, and figure out a way to do it. And I don't think we, or me, I should speak for myself, I'm not very well equipped from a medical standpoint to get someone through this. And I probably speak for you as well. We have very short appointment times with people. We don't have the training to go through this sort of thing. And so there's a group of people who are much better trained at this sort of thing. And so perhaps seeking out these people, psychologists or therapists, et cetera, I think are much better trained. But exercise is certainly an important first start, and self-recognition, and then as I talked about all those techniques, I think would be better guided by a properly trained individual.
The only thing that you didn't mention that I've heard about is sort of a rising area of interest is this area called mindfulness. And those are several areas in our state. I know that Salem Hospital and Mass General and the Beth Israel all have mindfulness centers, which I think is about this being connected to one's body, being aware of it, being able to use meditative techniques.
Meditation, yoga, Tai Chi, a lot of these things are very useful as well.
Very good. Well, thank you for a really great review, Dr. Srivastava, on stress and the heart. Recognizing it, understanding the importance of what it does to us physiologically, and ultimately its long-term health effects. So until next time, thanks to the viewer who suggested this to us. We'll see you here on Matters of the Heart. Good night.